Hi, my name is Niamh Kennelly and I'm continuing on from the last video in relation to protracted, retracted and inverted nipples. We kind of use inverted nipples as an umbrella term for any nipple that retracts or inverts, but actually they are two different things. A retracted nipple is one that pulls in when you do the pinch test, and an inverted nipple is one that looks inverted on appearance before you even touch it. So that's the difference between those two. So it's important to say that the most important thing when it comes to nipple inversion or retraction is that you latch your baby on. So you may not have any difficulty because of your retracted or inverted nipple. You latch the baby on and baby everts the nipple and absolutely has no problem with the latch, then that's great. You don't need to do anything, that's perfect. However, some women will find that they have that the baby has a big problem finding the actual nipple because it's flattened or inverted. So they actually do an awful lot of this and they can't find the nipple, therefore they can't latch on, or they just need an awful lot more help latching on. So we have a lot of mums who are say pregnant the second time and they know that they had trouble last time with their retracted or inverted nipple, and they want to know, is there anything you can do about it in pregnancy? So there are a few things. So the main thing is called Supple Cups. So Supple Cups are these little dudes, these guys here, okay? So they're food grade, made of food grade silicone, and they basically go over your nipple. They are then squeezed and they help to pull your nipple into the Supple Cup, and you wear them for a certain times of the day, and they help to correct or evert your nipple in advance of having your baby. Most important thing to say about these is to discuss using them with your obstetrician. And you would not be advised to use these before 37 weeks because anything that stimulates the nipple can actually cause preterm labour or contractions. So it's very important to talk to your obstetrician and not to use these before 37 weeks. They're the two things. So you want to use them and you want to know how they work. So here's my little nipple, okay? And what you do is you basically squeeze the top, pop them on centrally onto the nipple, okay? And then just suction will actually pull out the nipple itself. I find that if you use a little bit of lanolin or a bit of oil, like coconut oil or something like that, before you actually pop on your nipple shield, you get a better suction and it actually is a bit more soothing on the nipple. So you pop your bit of lanolin on here, all around your nipple and areola, and you pop on your Supple Cup, and it's a lot more comfortable to wear. The first time I tried on one of these, ow, it really hurt. But again, it depends on where you are, I think, in your cycle, whereabouts your hormones are at, maybe where you are in your pregnancy, because I tried them on another day and they didn't hurt at all. So what you can do is you pop it on, okay, for 15 minutes inside your bra. You can leave these on inside your bra. If you're having difficulty with them staying on inside your bra, what you can use is a breast shell, which keeps them in place. Now this isn't a breast shell, but it's like a breast shell. So I'm just using it for demonstration purposes. It's actually a milk collector. So you can just use it like this. So it keeps it in place inside your bra. So Supple Cups recommend that you pop them on and leave them on for 15 minutes on the first day. And then you increase that time every day so that they're on for up to 4 hours by the end of the first week. And that is Supple Cups. Now, if your nipple turns red, blue, purple, black, or white in color when you use these, you contact your doctor and don't continue to use them. So that is Supple Cups. So they are something to try if it's a thing that you feel you have inverted nipples. Now, when you do put them on the first time, they may really hurt. So just make sure you care for your nipples as well. And if it hurts too much, take it off, don't use it, okay? So that is the Supple Cups. Another thing you can use are breast shells. So breast shells, which look like this, I don't actually have one, but as I said, they're like these milkies. They basically are a shell with a little hole in the center, and they sit over your nipple, like this, okay? And the constant pressure, slight pressure around the areola on the run up to having your baby in those last 3 or 4 weeks can actually help to loosen up the binding of around the nipple that is keeping that nipple turned in. So that is that. They are the two things that I would advise, or that I have knowledge of prior to having your baby, if you want to try and evert or pull out your nipple or get your nipple more mobile and used to being pulled out before you have your baby. Okay.